Hello, welcome back. Yesterday we talked about ingrown toenails. We kind of gave you a definition of what an ingrown toenail is, where it's the edge of the nail starting to catch the skin and can grow into the skin area and get inflamed, painful, and tender. We talked about ways that you can actually soak it to try to alleviate any infection and alleviate some of the pain, how you can lift the edges by sticking something underneath the corners or even trimming out the corners to try to minimize the problem and postpone having to treat it in a way that is long-term. So the next question is, when should you be going to the doctor? And there are three things that I want to give you to kind of give you direction on when you should go to the doctor. Number one, if you have an infection that seems to be getting worse and it's draining quite a bit and really, really quite sore, you should go to the doctor. One, to fix the problem, and two, to determine if you need an antibiotic or something like that. A lot of times, a primary care physician will give you an antibiotic, but they will not treat the nail. This doesn't do you any good. You do need to treat the nail problem, because as long as there's an ingrown nail that the body treats like a sliver, the infection or the inflammation is not going to go away. Number two, so number one is if you have a really bad infection or it seems to be getting worse. Number two is if it's interfering with life. If you're saying, okay, this is hurting me all the time and it keeps coming back, or it's keeping me from doing things I want to be doing, go see a doctor, because it can be resolved really quickly, really easily. And number three, if you already treated this several times yourself and it presents, so if you're saying, okay, I treated it, it was good for a couple months, then I treated it again and it's good for a couple months, but it keeps coming back, the best way is to get it treated in a way so it shouldn't come back. So those are the three reasons, or three ways that you can determine whether you should go to the doctor. Number two is, so you've determined whether you should go to the doctor or not. Number two is, what should you expect the doctor to do? So I'm going to walk you through kind of the process of what should be done to actually really solve an ingrown toenail. If you go to the doctor and all they're planning to do is trim out the corners of those nails, you can do that at home. It doesn't really fix the problem long term. It only fixes it temporarily. Most of the time, the ingrown toenail will come back. So if it were me, I wouldn't accept that as a treatment. I'd say, okay, I want to do something so that I can solve this problem, hopefully forever. So they should be doing something that will allow it to be more of a permanent type fix. Now, there is one exclusion to that. I have had several infants or babies come in with ingrown toenails. I do not do anything permanent in a baby or an infant, because their nails are so different. They're so soft and they're changing that usually you can take the portion of the nail out with the idea that they may not get an ingrown toenail again, at least for many, many years. So in an infant or a baby, I a lot of times won't treat an ingrown toenail permanently, but even in children, I do. So it's something that we usually would do. So what would you do if you were going to treat the ingrown toenail permanently? To do this right, you've got to look at the nail. You say the nail goes all the way back to about that area. So you want to go far enough back on the nail to fix the problem. You can't just go to the portion of the nail that you can see. That is the reason that bathroom surgery doesn't usually work. It's the reason that you are going to the doctor. So this will require you to be numbed up. So you will get an injection, you will get numbed up. Now, with the injection, I'm going to use a finger here because I don't think anybody wants me holding my foot up, but you're going to inject, or they should inject back at the base of the toe. So they'll get the two nerves on each side of the big toenail, and a lot of times we'll cross underneath the bottom to make sure the nerves that are coming across the tip of the toe are numbed up. If they're injecting right around the nail or right at the tip of the nail, typically they're going to have, one, a hard time getting the toe numbed up, but two, it also is a lot more painful and a lot more discomfort in the process of trying to get you numbed up. For this reason, I usually would go to a specialist. I would go to someone that does this all the time, someone that does this once or twice a day, not once or twice a month or several times a year. That's not the emergency room. That's not an Instacare. That's usually not a primary care doctor. It's usually someone that does them all the time. We, on average, will do at least one ingrown toenail a day. So after numbing it up, then the toe should be washed and cleaned, similar to any other surgical procedure, because you're actually going deep and you're going inside the skin, basically, to do this. Because what you'll do is you'll trim a sliver of nail out all the way down to where it grows from and then take it out. This should be done in such a way to allow the nail to look very normal. It shouldn't look really, really small. It shouldn't look like there's lots of removal of a ton of nail. In most cases, you can take a small sliver of nail on one side or both sides and solve the problem and still have the nail just be slightly smaller and still look mostly normal. I've seen many, many nails that have been treated where they come back and they have only half a nail, or they have a nail that's misshapen or turns funny because of being treated for ingrown toenail. That should not be the case. In most cases, you can treat it without doing that. And then once you take that portion out, you need to do one of two things. You need to either create a chemical or physical burn to that nail bed to kill it. The most common way to do this is with phenol, which is a chemical burn. It's usually done on something that looks similar to a cotton swab or Q-tip type thing, and it's put on that area, and it burns the nail bed, so it should never produce a nail in that portion of the nail bed ever again. The other option is to surgically cut out that nail bed or trim it out. We do both of those. Typically, the phenol works for 99% of the individuals. If it's not working, we can do the other one to solve the problem. In most cases, like I said, 99% of the time, the nail should not grow back in that area. In rare situations, you may get a little piece of nail, you may get complete regrowth, or you may get just a little piece that grows out every once in a while that you have to remove. In that case, you can redo it if it never hurts you. Some people don't. So you should be numbed up. The portion of nail that is ingrown should be removed while trying to maintain as much nail as possible. And then the area should be killed chemically or surgically to make sure that nail bed does not grow back. And then it's bandaged, and you are given a couple different options as far as how you want to treat this afterwards. There are things you can do to soak it, warm water and Epsom salt to dry out any infection. Usually it will take you 2 to 4 weeks for this to heal. Or there are gels or salves or different things like that you can put on there. We have one called a healing salve that you can actually put on that reduces the recovery time to about 2 weeks. The goal being to get you back to normal as quickly as possible. One secret, once you've been numbed up and that portion of nail has been removed, in most cases, the nail will hurt less after the fact. So even though you just had surgery on that nail bed and on that nail, most of the time you hurt less right after, as soon as the anesthetic wears off, than you did before you did the procedure. So most people go back to normal activities, running, work, whatever they need to do, even really close to right after the procedure. So now you know, if you've got an ingrown toenail, you know when you should go to the doctor, you know how it will be treated when you're there, or what you should expect in the treatment there if you do have an ingrown toenail. I do recommend that you get an ingrown toenail fixed, because if you do that, you won't have to worry about it every 2 or 3 months. It can go away and can be gone forever. This is Dr. Brandt Gibson, and this is your podiatry tip number 8. And tomorrow, we're going to talk a little bit about fungal toenails and onychomycosis, and maybe even a little bit of athlete's foot.